All right. Now it will be an interactive session, so I will be answering your questions and asking you to contribute when I can. I may not be able to answer all texts that do come in, but I'll certainly do my very best. So we're going to start with writing, everyone. Writing can be quite challenging for a lot of people. So hopefully you'll get a few tips here that you'll be able to apply when you do take your exam, whether it be May 18, June 15, or sometime in the future. Now, I think it's very important when you're writing a medical referral letter that you keep the reason for writing central to your communication. Many of you will know that the writing criteria is gradually being updated, and come August, there will be further updates, which the OET Centre have provided information on about their website. Now, it's not in place just yet, but it won't be far away. But any type of medical writing, any referral letter, you should have a central theme, the reason for writing. So the very first thing you should ask yourself is, why am I writing this letter? And once you know why you're writing it, once you have it really clear in your mind, then that's probably the very first thing you should write about in your introduction, so it's clear immediately. And then when you select information, it should be connected to that reason for writing. And information which is not relevant or not useful doesn't need to be included. Other aspects you can consider: the medical history. The social factors may be relevant depending on the case. There could be trends in the condition. Maybe this relates to progression. Maybe the patient is getting worse or better. So that's all about the progression. What treatment and medication you've been giving, that can be relevant, obviously. And very, very importantly, the current condition. That's always essential because that's right now. Some of the past history may be less relevant, but the current condition, certainly relevant. So on exam day, you're going to have a 5-minute compulsory reading time at the beginning of the exam. So you should use that to mentally plan your letter. You won't be able to pick up a pen. You'll just be reading the case notes and taking time to understand it. It's quite a bit of time, 5 minutes to read those case notes. So I'd be really going it over in your head and ask yourself, okay, what's wrong with this patient? Why do I have to write a referral letter? What are the key elements here? If there's anything you don't quite understand when you first read it, then read it again. After that, you'll have 40 minutes to write your letter. And I suggest you spend 5 to 10 minutes for planning. Planning is really important, and it depends on the individual, but you're even given on your actual exam paper, there's a place to make a plan, how many paragraphs or what focus of each paragraph. So consider that. And then you've got 25 to 30 minutes to write your letter, 180 to 200 words. If you've done your practice, it should be sufficient. And then that's going to allow roughly 5 minutes, maybe less, to go over and double check any sentences. So what are we going to do with the planning? Well, I'm going to show you in a minute, but we have a method here which I think is quite useful. We've got the tick method. So put a tick next to information that you think is essential. Put a cross for non-relevant information. And quite an important category is U for useful. How do you know if information is useful or not? Well, that's for you to judge. If you think a piece of information will help that next health professional provide treatment to that patient, then it could be considered useful. If it has no relevance at all, then it can be left out. It is important, if you want to write with a good focus, you need to gain an in-depth understanding of the case. Make it real. Imagine it's your patient. And and then decide on how you're going to organise your letter. And that might vary depending whether it's an admission, whether it's a discharge, or some other type of letter. Okay, so we're going to do a case today, everyone. Bit of a general case here. You can see an image on your screen. And it says here, you are a health professional at Tara Hill Medical Centre. Now on exam day, it might say you are a doctor, you're a nurse, you're an occupational therapist. We'll just be general here. You are a health professional at Tara Hill Medical Centre, and Andrew Smith is the newborn son of your regular patients, Richard and Monica Smith. So that notes are always useful. There's always notes on the case notes to give you that background information. So make sure you read that. Now everyone, what can you see in this picture here? This is a bit of a warm up to the case. This is what's going on. So you can see this image of a baby. Can anyone tell me what's happening here? What's wrong with this baby? We've got some language here. Pyloric stenosis, got the image of the stomach and the esophagus. Type in what's happening here, everyone. What's going on? What can you see? Yes, there's vomiting happening. And can anyone be more specific? What type of vomiting is that? Can you think of an adjective to describe the vomiting? Betsy's very quick on that one. IHPH, yes. There's a word we can use, a type of vomiting here. Reflux, yep. Well done, Christian. It's projectile vomiting, where it projects quite far from the body. And the stenosis here, we can see some contraction there, and I guess that's causing the issue. So congenital pyloric stenosis, the abnormal narrowing of the opening of the pylorus, causes episodes of projectile vomiting. There it is. So that's our case. Let's continue. So we're just going to go through the case notes now before we look at a letter. So on exam day, you look carefully at this. Always pay special attention to the dates. You can see here we got different colours for each date. It's well laid out, and you'll find the exam is very well laid out, easy to follow. We should always read our writing task first. Use the information in the case notes. Write a letter to the paediatric surgeon of the emergency department, Spirit Children's Hospital. We have an address here in Queensland, seeking ongoing management. So we need ongoing management. In your letter, expand on the relevant case notes, expand them into complete sentences, no note form, use correct letter format, and an approximate word length. Let's find out, everyone. I use my pen here. So we've got the date, which is the 10th, that's today's date. And we know the patient first visited about 12 days ago. So always pay attention to time relationships. Got Andrew Smith, we've got a date of birth for the baby boy, that's important. The first child we would consider important. Normal vaginal delivery and a birth weight. All these might be considered important. Perhaps we may meant the on breast milk, that might be useful. Certainly type in what you think. Normal antenatal and prenatal examination, that might be useful. Okay, general checkup at 6 weeks. So that was the first checkup. Normal feeding, sleeps all night. Body weight was 3,050 grams. Everything's normal there. So you may not need to include that, but you may select part of that information, which we'll see in a minute. But things were pretty normal at that time, right? Then 1 week later, it's important that you connect dates. This is the 6th of March, but it's 1 week later. 1 week later, Andrew was vomiting. 2 days. Obviously very important. So this information is useful and we might summarize it, but now once we get down to specific facts related to the main issue, we need to mention it. Mother concerned related to feeds, accompanied by crying spells. Do we need to mention the mother's concern? I'd say it's optional. Let's just call it useful, but we don't have to. A crying spell sounds relevant. So that's the subjective. Now when we go to the objective, we know the baby was well hydrated and we have a body weight, no abnormality seen. There was a test of feeding, visible gastric peristalsis from left to right. Would anyone like to tell me what peristalsis means? Visible gastric peristalsis from left to right. Type in if you know the meaning of that. I'm sure many doctors and other professions do. Palpable swelling. Whoops, just go back. Palpable swelling like an olive at the epigastric region. And then, so that's our objective history. And then we have a assessment. What was the assessment? Someone mentioned it before. Infantile hypotrophic pyloric stenosis. That's what we know. All right, just checking the texts. Thanks, Chris. A few people have said there's intestinal movements, bowel movement. Yeah, so there's movement. Is it visible, everyone? Is the peristalsis visible to the naked eye if you're looking at the baby? All right, so it's nicely laid out. Subjective, objective, assessment, then management, an ultrasound examination review in 2 weeks. So quite a lot of important information there that we're going to talk about in a moment. And then on the final date for this consultation, this is 2 days later. No improvement. Still vomiting after each meal. Moderately dehydrated. So that's a change, isn't it? Because well hydrated on the 6th, but now dehydrated. So there's a change. Very good to write about change. Vomiting continuing. So that's important, isn't it? So when you're reading case notes, make sure you link between dates, because then you can make a bridge or connection, and that identifies the trends, the things that are happening that are the same or being repeated. That's going to help in your summary skills. There was a test for an ultrasound, and now we have the results 2 days later, where there is a thick pyloric muscle. And then we have a plan. Refer patient to pediatric surgeon via an emergency room. Patient requires fluid replacement and surgical management for infantile hypertrophic pyloric stenosis. All right, that's our case, everyone. Now we have to write our referral letter. You're going to help me with this one. So I've got a well laid out referral letter, but we've got some gaps here, everyone. So what I want to focus on, very importantly for you on exam day, is that you're accurate with your verb tenses. Because when you're describing a patient's history and conditions which started in the past and have continued up to now, you're going to need to be quite flexible with verb tenses. You're going to be able to use simple past, present perfect. You're going to be able to decide between active tense or active voice and passive voice. So quite a lot of things to do when you're writing your sentences. And if you make verb tense errors, it can affect meaning, and that will impact on your overall score. So we have, this is our model letter. It has the date up the top left, who we're writing to, the pediatric surgeon. We've got the hospital name and the address. That's all done nicely. Dear doctor, we've got the patient's name, and we've got a date of birth. So now we've got to start writing. Now this is where I want you to help me. I've got these verbs here. They all go in order. So we've done the hard work for you, but you have to conjugate the verb into the correct tense or form. That's your challenge, everyone. So I'm going to get everyone to type in the answers here. So first one, I am writing to what? What are you writing to do here, everyone? Once you know the answer, just tell me. It's going to come from this word, I'm writing to. Well done, Jane, first off the mark. I'm writing to request hospital admission for this patient. Now notice how I didn't say I'm writing to refer. This is helping me get my focus, everyone. Straight to the point. I'm writing to request hospital admission. So that's a way of being a little bit more direct. I'm writing to request hospital admission for this patient, a 2-month-old baby boy who, they've got this word assessed, who, something with infantile hypertrophic pyloric stenosis. Now I want to use, we got a second word here, so I want to use passive voice, everyone. I want to use passive. We're going to use the word assess here, everyone. Use the second verb. Yes, Hamid. Hamid's got assessed, but we can't say assessed with because somebody assessed him. The health professional assessed him. So we need to use passive, everyone. Somebody assessed him. The patient can't assess themselves. Somebody did it. Thank you, Hamid. Now we've got it. Who was assessed with, or, oh, I can say was, and I'm going to use has been. Now they're both correct here. And you might be asking, what's the difference between was assessed and has been assessed? Well, in this context, they're both correct. Was assessed means at a past time you assessed it, which is true. Has been assessed means at a past time you assessed it, and that assessment is still current. So actually, simple past and present perfect both work here. You have options. Now, I've got, notice the use of brackets here, everyone. We write the word, and you're allowed to use brackets for short form. And normally we state the word first, and then we place brackets after, then our full stop. That means we don't have to write it in full later on. Good for really long words. Let's continue. In terms of his birth history, that's a nice summary sentence, giving us summary phrase, giving us context. In terms of his birth history, he, what? Someone's already written it. He, so we've got this word. He, we got our be verb, sorry, the be verb. The be verb, everyone. Thank you, Cho. He is the first child of his parents. And that's not past tense because he still is. If you use was, then maybe he hasn't had a good outcome. So is important. He is the first child of his parents, Richard and Monica. We use commas here. And something normally. So subject he. Now we've got a choice here, everyone. This is where writing's interesting. He delivered normally, right? Now you could say was delivered if you helped in the delivery process. Was delivered is okay. That's indicating health professionals helped. However, you can remove yourself completely from the equation and say he delivered normally. Did it himself. Good little boy. Out he came all on his own. Didn't need too much help. He was in control. He delivered normally with a birth weight of 2750 grams. Let's go. Let's keep going. Andrew initially. So now that's, just before I move on, that's a nice introduction, everyone. A lot of, really relevant information. Notice how it's longer. It's a couple of sentences long. I think it's a good idea. That helps you to write a really well-focused introduction. Okay. Andrew initially. So now we're up to the word present. Andrew initially presented. Yep, he presented to my clinic at 6 weeks of age on the 29th of April 2019 for a general checkup. Notice how I've got the article, a general checkup, because checkup is a countable noun. A lot of people forget that one, for a general checkup. No abnormality. Ooh, this one, what have we, yes, we're up to C. No abnormality. Bridget's put seen, but we need to use passive, everyone, because you saw it. Somebody saw it. So no abnormality was seen. Thank you, Betsy. Was seen on examination. And his weight, something 305 grams. His weight, so, yep, was seen, and his weight. We've got to use show. Oh no, we've got to use be verb here, everyone. His weight. Now, I can't say has seen, everyone. Someone wrote has seen, but was seen. Somebody saw it, and it's past tense. Normally for examinations, we're going to use past tense more often because it's something that happened at a particular time. So no abnormality was seen on examination, and his weight, someone's written it in, was 3050 grams. He, something again 1 week later. So we've got the same word here again. He, we'll use the same word, it's the same tense. He presented again. I could say he, if I wanted variety, everyone, I could say he attended again 1 week later. If that'd be a nice touch. Or you can still use this word. He presented again. Now this again is very important. Presented again, that's giving us connection, everyone. We're linking back to the first visit. Little touches like that give you context. He presented again 1 week later with a history of vomiting. We saw that from the image for 2 days. Something crying spells. You've got this word associate with. So we want to change that to a past tense. How are we going to do that? Associate with is the plain form. We've got to change the word form. Thank you, Patet. Associated with crying spells. Okay, now we're going to talk about the examination findings. Examination something, a well-hydrated baby. We've got the word show. Examination. Examination. Still waiting. Thank you, Joe. Showed a well-hydrated child. Okay, and remember that we saw that in the case notes. However, visible peristalsis, because it's got the word here, visible peristalsis. Some people are writing the word shows back here, but this is past tense. So we must use showed, and then visible peristalsis. Thank you, Bridget, was observed, right? Because you observed it. Visible, and you know, because it was visible, some people said before, sometimes you can see it, sometimes you can't. In this case, it's visible. Visible peristalsis was observed on his abdomen, and a palpable olive-like mass. You've got to use the word feel. Again, we're going to use passive here because you felt it. You felt it. So how do we make the passive? We use the be verb plus the past participle. Be plus past participle. So we're going to say was felt. A few people are putting that in. I'm going to use felt. Someone wrote assessed, but because palpable, something you do with your hands, felt is good. He's something 50 grams of weight. We've got the word lose. Now I want to use I want to be careful here, everyone. He what? He now this is, I'm going to use past perfect here, everyone, because this is a past consultation. Wow, Ted got it. He had lost. And Bridget and Cho, he had lost 50 grams of weight and an abdominal ultrasound. So we've got lost. Order, everyone. What did you do? We're going to use passive. An abdominal ultrasound was ordered. Let's keep going. On review today, there. Now we've got to use a be verb again. On review today, I might continue. There was no improvement in his condition. In this case, you could also say there has been no improvement. Again, sometimes simple past or present perfect are both correct, depending on the intention of the reader. He something after each meal. We got the word vomiting. He something after each meal. So I want to use progressive here, everyone. He something continuous. He, and I want to use present perfect because they said still vomiting. Remember from the case notes, he vomited previously once in the past and he's still vomiting. Yes, thank you, Bridget. He has been vomiting after each meal, and we got the word look, everyone. Mildly dehydrated. And I want to use present tense here. Present tense. And looks, because it's still current. That appearance probably won't change. A couple of people put looked. You could put looked as well. Looked meaning at that time. If you say looks, it means you expect that that's not going to change. So they're both correct, but using present tense gives us some immediacy. The ultrasound result. So now we're going to use active. The ultrasound result, I'm going to use indicates because it's still current and probably, and the reason I'll use present tense here is that thickening is probably not going to go away. It's going to continue. So it indicates, it's still, that's why we use present tense, because it's unlikely to change. Given this history, I'm going to use mainly present tense now, everyone. I'll put here, I believe Andrew has IHPS and something. So this is about Andrew. I believe Andrew has IHPS and, so Andrew's something. We've got here need. Can you fill this gap? I believe Andrew has IHPS and needs, yes, because it's the boy who needs it, and needs urgent admission to something, his hydration status, as well as surgical management. To, what are we going to do? To, I think it's clear, to control his hydration status. So there it is, everyone. Wow, we have to do a lot of work with verb tenses. Lots of different verb tenses here. We've got plain forms. We've got present perfect who has been assessed by somebody, present perfect passive. We've got lots of simple past sentences. We've got lots of passive sentences, everyone. Look at all our be verbs. Look at the patterns there, everyone. Be verbs plus the past participle. If you have any questions, ask them now. So we've got had lost, That's our past perfect here. We've got examination showed that simple past. Associated with, again, simple past. When we get to today, on review today, we started off with the simple past. Then we've moved on to present perfect to indicate the condition is continuing. He has been vomiting after each meal. Then we moved on to present tense. Quite often we use present perfect, then a conjunction, and then we go to present tense for now. So present perfect up to now, simple present tense talking about now. And then we've continued with simple present tense to create that sense of immediacy. All right, so that's what you got to, the kind of things you got to be aware of on exam day. Verb tenses are very, very important. Hamid says, can we use past tense on today's visit? Yes, because even though it's today, it's in the past. It's before writing. So sometimes, like, his blood pressure was something. Some things that change or could change, like blood pressure, pulse, and so on, are often used in the past. Things which you think will continue or won't change. In other words, his hydration or the way he looks can be used in present tense. Chris says, I thought most recent reviews should be in present tense. Yeah, you can see a lot of present tense, looks and indicates and believes, and a lot of present tense there. Christian. You could, someone's asked, could we use the perfect tense had been vomiting? Yes, you could use had been vomiting, even that would be correct, because you're talking about what had been happened before. Has been just makes it a little bit closer to now. It's probably why we use it. All right, so lots of options and a lot of questions coming through, which is more suitable. And the bottom line is, everyone, that's not a simple answer. And just as you'll know from all the different things you've read, there are many options available. So it's not as simple as right or wrong. There's many things to consider and many variations because it's language, not a science. All right, now I've got more to do. I've got to move on to reading. So I've got one more thing to do here, everyone. Have a look at this page here. So what do you need to do on exam day? Well, this is here's some tips. In terms of grammar and vocabulary, the most important verb structures are simple past, present perfect, and passive voice. They're going to be the main one you use. You will use a little bit of past perfect perhaps, some present or future tenses as well. But do that review, everyone, before your exam. Practice, practice, and get confident. On exam day, you want to use a variety of structures. You're going to use simple, compound, and complex. So again, review in those areas. Be careful with word form, nouns, verbs, and adjectives. You need to make sure they're correct and that your sentences are balanced. Then you've got things like the mechanics of the language, singular and plural form, and articles and those sorts of things. You need to have be alert for those types of errors. And you don't really want to use casual or spoken English. So there's your little checklist, everyone. Go back and check your own writing and assess yourself in those areas. Attention to detail, very important. You've got to use the correct letter format like you just saw. You've got to make sure you spell the patient name correctly. Get the age right, get the gender right. That's what you do in that first 5 minutes reading. Use titles only with surnames, like Mr. Smith or Mrs. Smith, not first names. Double check your sentences for article use. Easy to make mistakes. Look out for those countable nouns, everybody. And I suggest you write in the pencil because it's easier to erase any errors and change sentences as needed. Now, we could talk about writing further, but I know a lot of people worry about reading. So we have to also be prepared for reading on exam day. So that's our writing, everyone. So now we're moving on to reading. I'm sure you have some concerns about reading as well. It's quite challenging. Part A, the speed reading task, just 15 minutes for 20 questions. And Part B and Part C, you have 45 minutes. And this is where we've got multiple choice questions. 6 for Part B, 16 for Part C. That's a total of 42 questions, everyone. You've got 60 minutes. I have it on good authority that you want to be trying to get above 30 to get that B grade. So that means you're going to have to perform quite well in all sections to get that overall mark. The reading is the same for all professions. So a quick little strategy here, everyone, for Part A. This is what I recommend. You can try it yourself and see if it works. But I think importantly, before you start looking at the questions, just go straight to your text and read the skim and scan, the 3 or 4 texts. I'd call this 50% reading. Read as much as you need to understand the purpose of that text, what it's telling you, the layout, why is it there? What does it do? What does it tell you? That's your purpose. Because a lot of the matching questions relate to the purpose. So you need to understand that. So allow 3 minutes to go through the 4 texts, underline keywords. Then for your matching questions, there's usually about 7. Allow roughly 4 minutes to answer it. If you're a bit quicker, that's okay. If you can do it, that will allow more time for the sentence completion and short answer questions. There are usually 6 sentence completion, 6 or 7, and 6 or 7 short answers. And these require a lot of skimming skills, but the matching requires a little bit more understanding. Let's do one, everyone, a mini practice. Look on the screen here, everyone. We've got a severity assessment. Now, it doesn't say here, but I can tell you this is for pneumonia. This is for pneumonia. So this is an example of a matching question, but I've changed the format to make it multiple choice because we're only going to look at one text. So this text provides information regarding. So if we read it, this is what you should do on exam day, everyone. And answer the question when you think you know it. But I would go, it's a table. It's a severity assessment. Read the heading. I've got mild to moderate and severe. I can see I've got columns, everyone. And here I've got infants and older children. And then I've got temperature, respiratory rate, taking full feeds. That's for mild to moderate and severe. I've got more information. I'm just skimming through. Okay, and then for older children, I've got different, I think these are symptoms, aren't they? These are all symptoms. Okay, question 1, everyone. Can you answer that? This text provides information regarding the treatment protocol for a child with severe case of pneumonia. Does it talk about treatment? Is it establishing the seriousness of a case of pneumonia in a baby? Or is it how much medication to provide a child with pneumonia? A lot of B's coming through, and the answer is B, everyone. Doesn't talk about treatment, it talks about symptoms but not treatment, and it doesn't talk about medication, so they're wrong. So that's the kind of thing, you'll see a heading, and you need to be able to match the heading with one of the 4 texts that you are given. Remember, this is a little mini text, but it gives you that concept. Okay. Question 2, everyone, we're going to do a gap fill. An infant who is still accepting something is more likely to have mild to moderate than severe pneumonia. It should have an E on it there. Severe pneumonia. An infant who is still accepting. So we see search word infant and mild to moderate. Type in the answer when you think you know it. Severe assessment, mild to moderate, infant. It's got to be here, everyone. Full feeds, yes, still accepting. And accepting means taking, so the answer is full feeds. Now I noticed some people just wrote feed You should put both words, I suppose. Somebody just wrote feed. You wouldn't get a mark. Jane and a few people who forgot Joe, if you forgot the S, you won't get your mark there. So this is copy and paste, everyone. Copy and paste both words. Copy them and paste them in the answer. No adjustment required. How many breaths per minute may indicate severe pneumonia in a baby? Breaths per minute. Baby. Severe. So we're going to go up to here, aren't we? Type it in when you know it, everyone. Respiratory rate. Can anyone see it? It's there. Thank you, Binu. More than 70. That's correct. More than 70, or you can use the symbol. 70. Okay, next question. What two factors must be considered when assessing whether a child has tachycardia? Here's our search word, tachycardia. Here we search around, we've got tachycardia here, but it's a child. So that's, I don't want to look at that one. It's going to be a child. So I'm going to go down here, everyone. Tachycardia. And I've got a little, what does this mark mean here, this little asterisk? Then I look down here. So remember, when you see an asterisk, it's like a note. Check the bottom of your text. Some of the answers can come from there. I can see answers coming in. Age and temperature. Correct. Okay, question 5. A pediatric patient with a temperature of 38 would be considered to have. So pediatric means infant. So we know it's going to be at the top. If they had 38, so greater than 38 severe, under 38 mild to moderate. So what type of pneumonia would they have, everyone? If they had a temperature of 38, would be considered to have. So it's a type of pneumonia here, everyone. Not less than 15 breaths, mild to moderate. There's your answer. It's not too hard, takes time, but that's just the process, everyone. You've got to find all the linking words, you've got to use all your skills to make everything match. And of course, it's a speed test. All right, I'm going to keep moving, everyone. We've got a bit more to do. Part B and Part C. So these are our multiple choice questions, everyone. And I want to look at two types of strategies here, everyone. QTA, question, text, answer. That means read the question stem at the top first, then your text, and then look at the answer choices, A, B, C, D. Right, that's the pattern, right? Then select your answer. QTA means read the question, then your answer choices underlining key words, then the text, and link back and forth to rule out incorrect answers and make your choice. My preference, I prefer QTA, question, text, answer, because the texts have enough depth that they can be, it requires you to understand that text. But you may use QAT if you're under time pressure and you need to be able to go a little bit faster. It may help you go to the relevant section of the text, but quite often you need to understand the whole paragraph to be able to get the right answer choice. Here we go, everyone. We're going to do one. According to the update, allergens do not need to be written. Let's look at this, everyone. Allergens do not need to be written on packaging. So we want to know, in what situations do allergens not need to be written on packaging? So it's all about the allergens. Now I've got allergens here, skimming, allergens here. I think I'm going to have to read quite a lot of this because it's mentioned a couple of times. Now I want you to choose your answer and I'm going to read aloud, everyone. Improve labeling for allergens. Health professionals are advised that new rules are being implemented for medicine labels to include improved information about potential allergens. While certain allergens, such as peanuts and gluten, were already required on medicine labels, the new rules include a longer list of substances that must be declared. So this is the new rule. So that's the update, everyone. So I'm close now. The additional substances include crustacea, fish, eggs, soy milk, and tree nuts. In some circumstances, here, this is my answer, it matches. In some circumstances, allergens do not need to be declared on the medicine label. And it's going to tell us when. Some substances may only cause a reaction if they are administered orally and therefore don't have to be declared if the medicine is only for topical use. That sounds important. And some substances are only declared if there's a certain amount of product. Got some answers coming through, some B's, some A's. Well, A, the medicine is intended to be taken by mouth. It says some substances may only cause a reaction if they're administered orally and therefore don't need to be declared. If I only read to the word declared, it might be right, but I've got an if, so I have to read more. It's not A, because that's only half the sentence. Don't have to be declared if the medicine is for topical use. So if you put it on your hand, on your arm, if you put it on your arm and it's not for oral use, then you don't have to declare it. What do you think the answer is, everyone? It's not A. The answer here, everyone, it's B. It's B, and a lot of people got it. Well done. And notice carefully, everyone, notice how different language is used. It doesn't need to be written on packaging if the medicine administration is unlikely to cause a reaction. Totally different words. They've used a summary phrase, everyone. Watch out for big words like this. That's a clue. The administration, it does say administer a couple of times here. So the administration, either topical or oral. That's what it is. C is a bit of a trap if there's a small amount of allergen in the medicine, but this says some substances are only declared if there's a small amount of product, not a small amount of allergen, a small amount of product. So that's a different topic. So answer B. Hard question, this one, everyone. Have to really think, but look for answers that tend to summarize a concept, is my advice. Let's move on. One more to do. Part C, everyone. Wow, here's a long one. We're going to do the same thing. Part B and Part C, very similar in that they're multiple choice questions. And we've got 4 choices here, A, B, C, or D. So we've got 4 choices to choose from. So that adds a degree of difficulty. But we'll use the same strategy, everyone. And when you think you know the answer, you're more than welcome to put it in. According to the author, why will it be challenging to improve the ethnic diversity of stocks in public UCB banks? Now, UCB means umbilical cord blood. We're up to question 5, everyone, so you haven't read the rest of the article, but it's umbilical cord blood. So according to the author, why is it challenging? Why is it hard? Why is it difficult to improve, make it better? The ethnic diversity, variety of ethnic groups of stocks. Okay, let's read it before we look at the questions. Firstly, wow, this is a long one, but UCB is everywhere. I feel we need to read this, everyone, to understand. Firstly, collecting and storing UCB is expensive and requires considerable and continuous government support. In addition, There are only a limited number of collection centres, and these tend not to be located in regional or culturally diverse areas. Always underline as you go. Resulting in continued low donation and recruitment rates from ethnic minorities and Indigenous groups. Okay, so there's low recruitment rates. Careful with although, everyone. This will be an important sentence because it begins with although. Although Australian public UCB banks show significantly more ethnic diversity than their bone marrow registry counterparts, note the comma, public UCB banks are still characterised by underrepresentation, not enough, underrepresentation of many ethnic groups, particularly Aboriginal Australians and Pacific Islanders. Okay, so there aren't enough of those ethnic groups. Given the increase, like based on, given the increase in UCB transplantation and the persistent underrepresentation of Indigenous Australians and ethnic minorities in UCB banks, recruitment strategies that best meet the needs of potential transplant recipients need to be developed. So that's what we need, new strategies that meet the needs of the recipients. This will not be simple, as such policies must take account of equity concerns and specific population needs. Phew, that's very long. Answers have been coming in by the good readers. Is it A, certain ethnic groups refuse to donate? Well, did anyone see anything about refusing? Maybe they don't want to or they don't, but refuse, it's wrong. Governments are unlikely to provide sufficient funds. Well, if they said it's expensive, but did they say that the government is unlikely to? They didn't say that. Hard to achieve a fair outcome for everyone. Well, we spoke about equity. It won't be simple, therefore hard, not simple. That sounds pretty interesting. Recruiting staff for regional centres will be difficult. Well, I know recruitment is difficult. It says here, but it's recruitment rate for the donors, not the staff. So the answer is, and many of you got it, answer is C. A bit of a challenging one though, wasn't it? There was a lot to read, a long paragraph, so definitely challenged us. But I think you really need to read the paragraph and try to rule out and work it out. But well done. Give yourself a pat on the back if you got this one, everyone. Great work. Okay, so that's been a quick rush through. We've gone quickly, but I'm just showing you some techniques that I hope you can use for the reading test. And my advice is this, everyone. Spend 2 to 3 minutes reading the text first, right? Do that. Try that with your last minute preparation. I guarantee you it'll be really helpful. A really good strategy, everyone. There are 7 matching questions usually. Try to get 100%. Try to get them all right, or even 6 out of 7 is not bad. But you need a good score here to set your foundation, because the matching questions are not skimming and scanning, they're more understanding. So they rely less on speed. But the remaining questions are about speed. So if you get a good foundation, even if you are a bit of a slow reader, you know, say your target's 15 out of 20, you're nearly halfway there. Part A, spelling counts. So if you make a spelling error, you're not going to get the mark. So make sure you spell correctly. Just copy and paste, everyone. Get the word exactly from extract it, copy it and paste it in the gap. You don't need to modify it. And stay calm and don't be a clock watcher. I don't think you can take a watch on exam day. They're going to confiscate it. But there will be a clock on the wall. Don't look at it. It's not your friend. You'll lose focus. Just look at your text. For part B and part C, like we just saw, read the question stem and the answer choices carefully. Make sure you understand what's being asked. Then remember, important information often follows words like however, yet, or but. Watch out for sentences that contain the word although. So complex sentences, and remember, in complex sentences, there is an independent and dependent clause. The independent clauses are very important and often contain main ideas. Try to think deeply, not superficially. Perhaps that first impression is wrong. We saw that in our part B example, that we had to think deeply to choose B there because it used different words, the medication administration. You're doing a test OET for health professionals, everyone. So use logic, use your medical knowledge, use all of your skills and training over the years to help in your decision-making progress. That's why you're doing OET, it's in your area. And manage your time in part B and part C. You still find a bit of pressure. Okay, phew, we've covered quite a bit, everyone. Watch the video if you need to go over any of these tips again. And I'll now just open it up for a few questions from the audience. This is your chance to ask any questions that you may have. While I'm waiting for those questions to come in, I'll just let you know a little bit about what we do. So OET Online, well, as I said before, I'm the director of OET Online. I'm also the founder of OET Online. We've been going for more than 10 years, long history. I've personally been involved with OET preparation since 2002. So we've seen all the changes. I think it's a wonderful test and a great opportunity for you guys to demonstrate your proficiency so you can move forward with your career. We've recently been endorsed in the areas of medicine, dentistry, and physiotherapy, the first provider that has achieved this status. So if you're a doctor, if you're a dentist, if you're a physiotherapist, we have the endorsed materials to help you for writing and speaking. But not only those professions, of course, we're already endorsed for nurses, and we also have excellent material for all professions that the OET uses in their assessment. So if you're an occupational therapist or a vet or a pharmacist or any of those 12 health professionals, we have a great task just for you. Yes, and a few questions. Sally says in the writing part, why didn't we use the recent today's visit first? We put a bit of background. We did it in order of consultation. We put the main issue in the introduction to summarize it. Then we painted a picture, but you know, in chronology, but you could have put all the recent details first. That is an option as well. So you have choices here. Glad you like it, Bridget. Thank you. So Houdin says, do you provide letter correction service? Yes, we do. Visit our website. Ezra says, in dentistry profession, if there were multiple visits in the case, can we add each of the visits? I don't think so. Dentistry tasks have a lot of visits, so I would be condensing them and saying, you know, over many visits in the past year, the objective of my treatment has been to. So you want to summarize there, Ezra. Yes, Hamid, spend 2 minutes for part A, reading the text, then go to your question sheet is a good idea. Just going through a few comments here from everyone. Are we allowed to underline words from the text? Yes, you'll have your pen in your hand, so you definitely can underline as you go, absolutely. Social history, someone's asked where to mention social history. Well, it can go a standalone paragraph, perhaps toward the end, but it's case by case. have a look at the model letters on the OET Centre website and try to work out, but it depends how relevant it is. There's many places it could go. So there's no simple answer to that question. Tips for slow readers, says Fatima. Well, look, just read a lot, everyone. Read every day. Develop those skills. I mean, speed reading takes a bit of time. Read magazines, read articles, and just push yourself to read faster. Try some English puzzles, everyone. Word search puzzles that you can find online. Google word search activities. Use old Part A from the old exam. Old Part A, you still have to skim and scan, and you have to be very quick. So use old Part A tasks. More comments coming through. What about listening? I won't go into listening, Forrest. That's maybe for the next session. Chippy says, writing a letter to social worker, is it mandatory to write social history first? The word mandatory means must. It's never like that in their exam. There are many roads which lead to Rome. So it is case by case, and that's where your planning comes into play. You have to think, because you don't know what you're going to get on exam day. So that critical thinking skill from you is something to develop. You can put your signature if you wish, Ma, name, but that's optional. When's the next prep hour? In about a month's time, there'll be another prep hour. We'll maybe go for listening and speaking then. Rebna asked for, particularly for radiographers, we've got some great radiographer courses on our website. I reckon you enroll in one of those, Rebna. That'll give you excellent practice, just like the exam. All right, and I think I've got, so hope that's been helpful, everyone. I think I've covered that. We're out of time. Just so you know, we do offer doctors-only writing courses. We have nurse-only writing courses. And we also have profession-specific writing courses where some of the lesser covered professions, like radiographers and dentistry, we put all them in together, and there are smaller groups. Great new classes, everyone, that really address your needs. So definitely come to OET Online and sign up in one of our excellent virtual classes. My name is Steve. I'm one of the teachers on the course, and you'll meet other teachers as well. And we've got great time zones, everyone. So no matter where you're located, you'll find that the times are compatible. But if you miss a live class, watch the recording afterward. So check out the website for details. I wish you all a wonderful exam result. It's been great spending this hour with you. All the best, everyone, and good luck in your next exam.